Welcome to the MPH Lens. I'm your host, Brianna y'all. Come learn as we dive into mental health conversations to help you better address your mental health challenges as a public health professional.
My name is Brianna Baker. I am a fourth-year Ph.D. candidate at Columbia University studying counseling psychology. And I have a public health background. I don't want to say I'm a public health facing psychologist in training, but I don't officially have like an MPH. So it's always interesting when I'm in these spaces because I went straight from bachelor's to PhD program and worked in public health along the way, but didn't officially get the degree. So it's always honoring to be on podcasts such as these. Background wise, I born and raised in North Carolina. I did a lot of my public health work at the University of North Carolina at Chapel Hill, where I went to undergrad. I moved on to RTI International and worked there for a couple of years as a public health analyst. And now I'm currently in New York City at Columbia.
Awesome. Thank you for sharing that with us. That is super cool that you are from North Carolina. I have a few family members that live around that area, so that is super cool. And congratulations to all of your accomplishments. It sounds like you have so much opportunities and experience that is centered in public health. I definitely think that's super cool that you represent people who haven't gotten their master's in public health, but still have that went straight from their bachelor's to their doctorate. So that's something that I would be learning a lot from hearing more about your experience as we continue on. Today, we will discuss how to prioritize mental wellness and still achieve your professional and educational goals. And what does mental health mean to you? Why is it something that's so important? And how does that align with your background?
Yeah, that's a good question. I mean, mental health is something that I've always thought about, or at least always felt. I think even though we may not have always had the language for what is mental health, I mean, ever since we were younger and able to feel and experience emotions, like we have had some sort of experience with our mental health. And for me, this journey began a really long time ago. Like I mentioned, I was from North Carolina. I grew up in a very predominantly and homogeneously white community, conservative in the South. So my experience in school was usually being the only Black girl or the only Black person in the room in a very conservative environment. And I remember feeling so isolated as a child and so frustrated that I didn't fit in with other kids around me. Like my hair wasn't the same, my skin wasn't the same. And it really took a toll on the way that I viewed myself and how I viewed my abilities or my looks. Everything about me was so couched in this white supremacist environment where I just felt intellectually, physically, mentally inferior to other people. And I think that I carried that for a really long time. And it wasn't until, so for me, I'm like aging myself right now, but for me, Trayvon Martin was murdered in like my sophomore year of high school or something like that.
Mm.
And it was a really profound experience for me because I hadn't put too much thought to police brutality and what it meant to be a Black person in this country. But that moment in society really caused me to reckon with that. And I had to do that reckoning within an environment that supported the police point of view. And from then on, I was like, this is messed up. Like this experience of being Black in America is so heavy. And I made kind of a commitment to myself to study, to research, to understand this experience. And once I got to college and realized that that experience was kind of universal among a lot of Black folks, it wasn't just me, I became even more interested in mental health in general. How can we make it so that Black Americans especially feel good about themselves?
Mm-hmm.
I study a lot about self-worth and self-esteem, and also feel like they can be themselves authentically in a world that is constantly binding us to certain stereotypes or taking away opportunities from us because of our backgrounds. It's a really long like answer to what mental health is for me, but at the same time, like I feel like I have to nest it within that type of like rhetoric, because that's why I'm so enthusiastic about mental health.
Quick break. Come join the public health community with a 7-day free trial. You'll get access to learn, navigate, and transform your public health career through mentorship, coaching calls, resume, cover letter, and LinkedIn workshops, exclusive videos from yours truly, and much, much more. If you've been looking for career support, mentorship, or want to build your brand, look no further. Join the public health community today for a 7-day free trial at phmillennial.com/join or from the link below. Let's build a stronger public health community together. Now, back to the show.
Such an amazing response, honestly, and an amazing, impactful journey that you've experienced that led to you to your purpose. And I definitely can relate to your experience growing up. Myself, I was raised or grew up majority of my childhood in a predominantly white neighborhood, and it was just common for me to be the only person or one of the few Black people in my class. So it was
Mm-hmm.
hard to find like that representation, and actually feel good about myself because there was so few representation that I had like to look up to just from where I lived. So I definitely can relate to that. But as well as just police brutality, there's so much craziness going on in this world at this moment. It's just so much social injustice issues that is going on, and if it reminds people of anything, is just to always prioritize your mental health, because it really can take a toll on somebody,
Mm-hmm.
having that type of exposure to so many crazy things going on. Um, I
Yeah.
would also love to get into some questions about, um, like, what would you describe to be um, a main mental health challenges among public health professionals and students today? I know that you've mentioned that you are currently pursuing your PhD. Like, what is your experience, and how do you like maintain and prioritize your mental health with having so much things to maintain?
Yeah, I really appreciate this question because I think it's something that I'm constantly talking about with myself and trying to prioritize my mental health. As students, and you were saying this before we started recording, but we do hold a lot of different roles. And I honestly think the word student is a little misleading given all the things that we do. So for me, and just talking about what it's like to be pursuing a PhD in counseling or clinical psychology, is I'm partly a researcher, I'm partly a therapist. I work at a clinic that serves children and family who have experienced neglect or physical or sexual abuse. So that is very heavy and it takes a toll as well. TAing or teaching is another component of that. Applying for fellowships and taking classes, like all of that together is, more than your typical like 40-hour work week. Like I'm starting to get jealous of the 9 to 5 life because this is just all over the place. And so I see the mental health concern with students, I guess I would say, is one, just like potential for burnout, because within all of these different roles, you're expected to give 110%. And that's literally just like impossible.
Yeah.
And I think a lot of that comes, and again, I always speak, usually, especially for those of us who have marginalized identities, like that desire to overcome, to prove, to be like extraordinary, I think is something that is fueled by imposter syndrome that can happen a lot with us. But that makes it even more so like we feel like we have to work so hard in
Yeah.
these roles. So in my classes, like if it's not 100%, like that's failing. In my clinical work, if my patients aren't making progress, have I failed? Like I think that it can easily lead to a lot of self-doubt and to a lot of burnout trying to be the best all the time.
Mm.
So that's definitely something. And I think the other thing is just the fact that for those of us who choose public health oriented careers, it's, innately a helping career.
Yeah.
And anytime that we're extending ourselves, it's often that we extend beyond our boundaries and our capacity, especially when we're just starting out. Like as a student, I think for me, I'm like, I want to I did this because I wanted to make a difference. And if I'm not making a difference, what does that say about me? So I think that that's another part of what can make this experience of being a student especially difficult, on top of dealing with a lot of bureaucracy and politics that may be present within the field or your department as well. That just adds another layer to everything that we have to go through as students. And so, yeah, for me, managing that has been a journey, and I'm in my fourth year now. And I feel like I'm just now getting to a place where I can effectively manage, my stress, my anxiety, and kind of mitigate wanting to be the best, but also needing to be here for myself as well. Yeah.
I love how you mentioned imposter syndrome, and because I think that's just such and burnout, that's such like a relative thing that a lot of students experience. It's just really important to build in routines and take that initiative in being aware of your patterns and where it's leading you, whether it's effective or not, or whether you're overwhelmed or not. I feel like in this profession and even as students, you always want to like put your best foot forward,
Mm-hmm.
and it often leads to people over compromising themselves in
Mm-hmm.
exchange to achieve that. There's that lot of like go getter type of approach that is just kind of glamorized. I feel like burnout is somewhat glamorized. People take pride in how hard they put forth, like their effort into things. But it's just important to always prioritize your mental well being while doing so. And I always was just curious of how people, like professions in public health, how we always like mention, our job is to promote better health practices for the population, the community, the public. And I feel like in the work that we do, it kind of leaves less room for us to even provide that for ourselves.
Mm-hmm.
And so it's just interesting to hear a different perspective too on how it's just a common challenge for everybody. Um, and it does take time to effectively come up with a routine that works best for an individual person. Like what certain practices have you added to your routine that kind of transition into you effectively maintaining your mental well-being and prioritizing yourself, meanwhile as you are achieving your goals and still like meeting your expectations as a professional and as a student?
Yeah, I feel like for me, I think there are specific practices, which I'm definitely going to talk about. But honestly, it wasn't until like my mindset shifted, I think. And once I gained more understanding of what I was up against. And what I mean by that is just, you talked about how burnout is glamorized. And that is because the culture that we live in, the society that we live in, is one that really does prioritize working yourself to the bone and giving that 110% as a badge of honor. And I say everything is rooted in white supremacy. It is rooted in like capitalist structures or capitalist thinking. Um, and rooted in a way, honestly, that just is so incongruent with who I am and who I want to be. And I think for me, once I realized that I was up against a system that literally by design is meant for me to burn out at this rate, that is meant for me to feel like I'm constantly not worthy enough. And so having to like prove myself, once I realized that that is literally the design of our world, it became easier to resist that. It became more empowering for me to resist that. So I guess what I mean by that is like I would come home after a very long day of doing an assessment, which can take maybe like 2 to 4 hours, and not eating lunch or not eating dinner and coming back and working until 3 a.m. and just to do it all over again and feeling like that was what I was supposed to do. Like now that just doesn't happen. Like I cannot let the system win in that way. I can't let myself be victimized in that way.
Mhm.
So now it's just like letting go of what the expectation is from society, and really leaning into what my expectation is for myself, constantly asking myself, like, why am I doing certain things? Why am I working on this manuscript until 3 a.m.? Why am I working on this report when I know it's not going to make a difference if I get it in today or next week? Like, why do I feel this sense of urgency? Where does that come from? And constantly having to negotiate and renegotiate with myself about things that I'm doing, that is, as a practice, I think has helped me a lot with prioritizing my mental health. But it's a lot easier said than done. Like, I I don't want to say this works all the time. Like, sometimes I'm like, Bree, just get it done. Like, and I work, and it is what it is. But I do think that as I've gone through school, I've been able to at least see things in their totality, or see the bigger picture, rather than like, I just have to do this just because I have to, like taking it a step forward.
I love how you made it, you worded it as you kind of, it kind of samples a to-do list, like what you prioritize, what's priority, I think, and
Sure.
what is, and sometimes your priorities, there could be a really a priority that's like listed as a red, a priority that's listed as a yellow, something that you have to immediately get done or can wait another day. I think that is a really great approach on how to manage a large workload or responsibility, as a professional and as a student. So I think that's really um, a great way that you kind of organize, what's really important at the end of
Mhm.
the day, and ask yourself those questions. I feel like that's like you showing yourself grace. You show
Right.
yourself grace by asking yourself those questions. I'm like, why am I doing this? Like, what makes me feel? And I feel like that's something that needs to be more common amongst a lot of us professionals and students, that, it's difficult to show yourself grace because you kind of just, you have so many deadlines that you have to keep up with, and you feel that guilt of not like getting all your responsibilities and tasks done at a certain time. Like
Yeah.
it really can take over somebody, mentally, and strain, their mental health and well-being. So I feel like it's a very important message that, you show yourself grace, and you definitely seem like a person that does that, and that's really awesome.
Thanks.
Why did you decide to pursue PhD in counseling psychology, and how does this tie into your work in supporting mental wellness?
Yeah, good question. I have always been interested in psychology. I think for the reasons that I listed before, like I've always been so cognizant of, like, I guess, the impact that socio-political environments have on our thinking, on our self-worth, on what we perceive to be our abilities. That's always been something that's kind of top of mind for me. Of course, I didn't have the language for it. It was not like I was speaking like that as a seventh grader, but I was very, very perceptive
Mm.
of the influences of racism, of inequality, and eventually of inequity. Um, and how that impacted mental health or just my thinking in general. As far as choosing the degree, that was an interesting journey. Once I got to college, I think I naturally gravitated towards psychology. I kind of bounced around different like types of psychology, like developmental psychology, because I was interested in how kids develop their identities. I thought that was really interesting. But then I found clinical psychology because I was like, wait, like I don't want to just learn about it. Like I want to treat it. Like I want to be in the room as a therapist and do things. And counseling psychology is extremely similar, but counseling psychology has more of its roots in social justice and in kind of healing or strengths based approaches. And so I found that that's really, really what I wanted to do. Um, I did kind of wrestle with if I wanted to pursue a PhD in counseling psychology, or if I wanted to do something that was more directly like public health. I mean, there are doctorates in public health, there are masters in public health, and I really liked that. But there was something about being able to treat people one on one or in groups or develop community programs as a psychologist that I felt like I really wanted to do, because it felt like just the right path for me. Now that I've gotten into it, I've seen people, they're able to do it without this degree, but the more you know. But I do think that it was the right choice for me, especially because what I'm really passionate about is public facing psychology, is how do we make these phenomena that we know about as psychologists or as professionals available to the public. Then how do we create public facing programs or like social programs that can respond to some of the mental health inequities that we're seeing in society? And then on top of that, how can we use our expertise to influence or translate policy as well and make structural changes so that the things that we're seeing, the disparities that we're seeing, can cease to exist from a structural level, kind of a top-down approach. So for me, it all worked out in like how I think and conceptualize, but I also think that there's a million different ways I could have gotten to where I am, if that makes sense.
I completely get it. I can relate to that. We have a similar connection. I have my bachelor's degree in sociology. So like the study of like just how everybody's behaviors contributes to, how contributes to just a bunch of factors of things. But it was just great having that connection of seeing how people's behaviors and interactions with other people. So yeah, I definitely understand like that interest of you pursuing psychology and its connection to public health. So, for our listeners who might be unfamiliar, could you explain the distinction between clinical mental disorders and everyday stress challenges, and everyday stress or challenges?
Sure. Yeah. So there's a big fancy book in psychology called the DSM-5, which I don't know if you're familiar or if like listeners are familiar, but it's the Diagnostic Statistical Manual of Mental Health Disorders. And basically, from my understanding, though it's kind of testing my knowledge, a group of people, a large group of people, come together and decide what criteria suits a mental disorder. So, or, a psychological disorder. So, for example, depression. What are the criteria for depression, and how many of those criteria does a person need to meet the clinical threshold for being depressed? So, for example, like, a low mood is something that typically characterizes depression. Inability to engage or participate in daily living tasks, such as brushing your teeth or showering or things like that. That may be another one. Thoughts of unworthiness or extreme sadness is another criteria. So once a person meets a certain amount of criteria for a psychological disorder, they can then be formally diagnosed with that disorder. And that process of diagnosis should take a while. I mean, people will tell you different things. If you go to your primary care doctor, they may give you what's called like a screener that has maybe 10 questions on it. And you circle like all the time, sometimes, a little bit, not at all. And they can make a diagnosis based on that. That's not how I prefer to do things. That's not how most psychologists will do things as far as diagnosing someone with an actual like clinical disorder. It's usually through talking with someone, something that we call like an intake interview, learning about, what's their daily life like, what concerns them, what are their thoughts like, what are the behaviors like, are they like getting out of bed, what are the relationships like, things like that, so that we can make a holistic understanding of a person, as much as you can in like a few sessions, and then diagnose them clinically. So the difference between something that meets that clinical threshold or that clinical criteria and like I think you said like a daily stress or challenge is just the fact that it meets a certain amount of the criteria that's been listed in this book, this diagnostic manual that we use in psychology. I can like talk about this all day. There's, how people decide what makes up a mental disorder is through research. As we know, research tends to be on certain populations and demographics and not others. There's been a lot of research that says that, like disorders present differently in different populations. What depression looks like in a Black woman who is high income who is in, say, who has an advanced degree may look different than a white man who is low income, right? Like there's so many different factors that influence how we can present in the world and to what extent our depression or anxiety or any other disorder may show itself. And so that's been something that's been a topic of discussion for a long time is, things just look differently in different people. Just because someone is smiling and happy and overachieving doesn't mean that they're not depressed, right? Like it doesn't have to look like I can't get out of bed, even though that's what we typically associate with a depressive behavior. And I'm using depression just because I feel like most people know what depression is. But this goes for any disorder, personality disorders, even it can all look so different.
That's very insightful. Honestly, I feel like a lot of people are not as well versed with the clinical aspect of what depression and mental health and how the process of how it's usually conducted when diagnosing people. I feel like a lot of um, people fear of being misdiagnosed,
Mm-hmm.
especially I like how you mentioned depression looks different for everybody. Just being a Black woman, characteristics of how we take on stress is vastly different, as you mentioned in your example too. And you mentioned a person who has a high income that's a white male versus a Black woman who has a high income. The stresses in those two different categories look vastly different and
Absolutely.
can easily be misdiagnosed. So that is also like a concern, and but also I feel like should motivate more people to want to do more research in those fields, because those are the areas that are oftentimes neglected and continues.
Mm-hmm.
And so it's very important to be aware of how these diagnoses can connect to different behaviors for everybody. So it's so important for people to seek out these resources and do their own research and ask for and openly communicate, their concerns to other people to have a better understanding on how to go about it. And I would love to also get into this question about like why is professional intervention often necessary for clinical cases?
Do you mean like seeking like a psychologist or like a mental health
Yes.
professional?
Yes.
Yeah, I think that's a common question and even a fear of people's, like,
Yeah.
why would I talk to this stranger about my issues when I have my friends or when I don't want to talk about it at all? Psychologists, therapists, counselors were trained, to be able to listen, to take in this information clinically for you to be able to live your life in a way that is, the way that you want to be able to live it. And I think that as much as we love our friends, as much as we have maybe other support systems or don't have other support systems, they're not able to offer us often like the unbiased perspective. A lot of times we can't show even our closest friends or our closest family how we're truly feeling because there's so many other factors that could impact that relationship that we may not want to dive into. Also, I mean, it's not necessarily their job, right, to take care of our mental health. And so when you seek a mental health professional, it's really the first step or a really good step that you can take in your mental health journey of saying, I'm committed to getting better. I want to work with someone on certain things. I want to stop feeling this way. Like, let me do that with the help of someone who is trained to be able to help me live my best life. That doesn't always happen. I'm not going to say there's lots of types of professionals out there. There's lots of types of services. And so it can be disheartening when you feel like you're not making that progress or that you're not clicking with your therapist. But I do think that it's something that people should seek out that can be extremely helpful and more helpful than talking to a friend. And worst of all, bottling it all inside and not talking to anyone about it.
Yeah. I completely agree. I definitely feel like it is super important to make that commitment to yourself on wanting to get better when you are seeking out resources, because that's how you best benefit from the experience. That's how you get to that point of getting better. Just seeking, and there's so many different resources. I know everybody, like everything, things work differently for everybody, and people have different experiences. Um, what works for someone probably won't work for someone else. So that's
Right.
really good that, we kind of, as public health professionals, keep exploiting out those different resources for other people to seek out, because there's common misconceptions about people who seek counseling, and especially I feel like it's relevant in certain communities where
Mm-hmm.
it is just so against a lot of like people's morals or values to seek out counseling, when it's just such a beneficial thing, to seek out those resources. Um, and now that we're on the topic of misconceptions, like what are some common misconceptions about clinical mental disorders, and how can dispelling these misconceptions contribute to better health outcomes?
Yeah, I mean, there's a tremendous amount of stigma around mental health. It's just now, I would say, in the last like 10, 15, 20 even years that we're really like talking about mental health in general as something that affects the general public. Because before there was a distinction between those who have mental disorders and those who do not. And there was no in between. Like either you are great with your mental health or you're quote crazy and you belong in an asylum or an institution. So it's taken us a long way to get to where we are. And it's still not like something that we're talking about. It's hard for me because it's like I'm in this field, I'm talking about it all the time, and then I get into the real world and I'm like, whoa, like, yeah, people really, it is highly stigmatized. I think especially for, you talked about cultural differences and in some communities where getting help is stigmatized, like I think that's for an abundance of reasons. I think that religion can play a big role in it. I know it did for me. You're feeling this way because you're not praying enough, you're not faithful enough. Like that was a message that I remember receiving when I was younger. Also, don't share family business. Like that's another thing. There's a lot of mistrust with medical professionals and healthcare providers. And that's what I am classified as a psychologist in training or a therapist. So I think that there's a lot of stigma with seeking help outside of the home,
Yeah.
knowing historically what healthcare institutions have done to our communities and our people. So I think that it's something that needs to be destigmatized, but first it has to be talked about. And I think that a lot of like mental health organizations or mental health professionals aren't versed on the historical harm that's been done through healthcare. So I think that that's something as well. And then I think that there's just the tendency, again, as we talk about like our society, of not wanting to ask for help and not needing help. And that being, again, that badge of honor that I can do it all by myself. I am strong, like I'm resilient. Like, these are things that we've been taught to really glorify and to really want for ourselves to be independent. Whereas I think, the benefit in mental health outcomes comes from the fact that as humans, we're always seeking connection with others. That's a natural thing to want. It's a natural thing to want to share. It's a natural thing to see your health as connected to others. That's why we have relationships in general. That's why when you go out with your best friend and you're talking for hours, you feel good after. Like
Mhm.
that's just a part of human nature. And I think the more that we can talk about that, the more that we can emphasize that, um, the more or the less stigmatized that mental health and seeking mental health care will be. And the benefits as far as mental health outcomes are tremendous. I mean, people are finally getting to talk about parts of themselves that they felt ashamed of, that they felt guilty about, and getting to do that with the intention of building a better you or improving yourself, improving your lifestyle, improving who you are, or just getting to be who you are in general, um, can help a lot because a lot of us live with a mask on. A lot of us live very inauthentically because of our environments. And when you spend your whole life hiding or ashamed, that can make you feel self-hatred, disgust, um, not worthy.
Yeah.
So I think there's a lot of benefits from seeking mental health, and there's also a lot of work that we have to do to get there.
Yeah, I completely agree. I definitely feel like I love how I visited your website, and what stood out to me was how you have authentically Bree, and as I'm interviewing you, that's something that you commonly mention, and I feel like that is something that's so um, is such a good reminder to authentically be yourself. And I think the message that, you know, throughout this interview with the questions that I'm asking you, it always stems back from just not only your personal experiences, but just always grounding yourself when you're facing any challenges, or just going about your day to day, to always just authentically be yourself. I feel like that
Mhm.
good reminder for people to prioritize their mental well-being. Is I feel like when people we're in a society where it's just okay for people to wear different masks, and
Yeah.
want to just not openly communicate their true feelings towards situations. Communication is even a huge issue, not with
Mhm.
social media, and like people constantly being glued to their phone. Communication is often an issue to kind of spread that awareness. Like
Mhm.
with your peers, people just kind of isolate themselves, or
Mhm.
it's common for just out of comfort to isolate yourself. It's easy for somebody to like look up on their phone than to speak to the person that they're sitting next to. So even those little interactions, definitely, I feel like, that connection to people is what helps ground people to be there, to just be present and show themselves grace and gratitude when they're facing these challenges. So I loved all your responses, honestly. You've been such a great support as I'm trying to navigate through this interview.
Yeah, no
We're going to
worries.
wrap up shortly. I just wanted to ask a few rapid fire questions for you.
Okay.
So, what is the non negotiable self practice that you prioritize to jumpstart your day?
To jumpstart my day, honestly, people are gonna argue with this, but coffee. Like, I look forward to my coffee in the
Yeah.
like, I feel like more than the average person, like, when I wake up, I'm, like, excited to go to get
Yep.
my coffee. Um, but it's a routine, and it's something that makes me feel good, and, I don't know, that's a non-negotiable for me.
I completely agree with you. Coffee, I'm a caffeine, like, that's just how I look forward to it. I enjoy it so much. I smile as soon as I have my first sip. So I can completely relate.
Yeah.
And what are you working on improving in your life right now, presently, with all that you have going on? But just something that just um, you're working towards improving that connects to you maintaining your mental well being.
Yeah, I think, something I've been really working on is, for me, like, faith is very important, and, faith in a higher power, but also just, like, faith in myself is something I'm working towards right now. I'm in a period of uncertainty for my program. We have a year-long internship, or like a residency, and I'm very thick in that process right now, and not knowing like which state I'll be in next year at this time. And it's very anxiety provoking, and I have to constantly remind myself to be faithful when I'm receiving rejections from places, or when I'm receiving interviews to places, to just be faithful in my own purpose. And so I think that that's something I am trying my best to really own in, but also it's incredibly difficult when it feels like you don't have like power. But being faithful, we'll go with that.
And that is something that I can for sure relate to. I think faith is that connects to home for me as well, and is what motivates me. And even on another thing that I would like to point out on your website, you mentioned creating our legacies together, threaded through love, guided by faith, and infused with purpose and passion. It was definitely a message that stood out to me, especially going through finals and managing, the whole internship and whatnot, the same procedures. and experiences that you happen to relate to. It
Mhm.
is an empowering and inspiring thing to hear, and a great reminder to keep pushing forward um, towards your passion and helping others and other public health professionals and other students who are struggling to have that motivation. Definitely, I advocate to seek out resources just to start talking about with, among your peers, or just have communication on just, you know, little things. It doesn't have to be, you sharing your whole life story to a random person, but it's really important to just talk more about, feeling overwhelmed. I feel like once you talk about it more, it kind of alleviates some of that stress. Um,
Absolutely.
and having faith is definitely an outlet that I use myself. So that is awesome. But thank you so much for meeting with me today. Thank you for the listeners for the episode of the MPH Lens. Be sure to subscribe that you can stay in the now when we dig deeper into mental health conversations, and be sure to share with an MPH student that would benefit from this. And is there any platforms that you would like to advocate for people to further connect with you and follow along with you on your journey?
Sure. Yeah. My Twitter is Brianna A Baker. So BriannaABaker. I'm probably on Twitter or X or whatever it's called the most, though a little bit less now. Also on Instagram at Brianna.A.Baker. So you can find me in those two places.
Great. Feel free. Thank you so much once again for interviewing with me and bearing with me. I really appreciate it. For my first interview ever, it was such a pleasure speaking with you, connecting with you, and best wishes on, your journey as you continue on with your education and professional pursuits.
Awesome. Thank you so much. It was a pleasure talking to you. And yeah, I can't wait to hear this.